Good morning, CDDA members, and actually I think it's just afternoon now. My name is Angele Poitras, and I'm the Community Engagement Specialist with Workplace Safety North. I want to thank CDA members and Louise for having me be your guinea pig for your very first webinar. So those that are joining us, thank you very much. I will ask that you hold your questions till the end, and then what we can do is unmute you and we'll be able to have a dialogue. I hope that's okay with you. So as we get started, I'm going to be showing you a PowerPoint. It is going to be hosted online at CDDA after, if you wish to share it with some of your teams. So what we're going to do is we're going to go directly to the PowerPoint now. Thank you. We're having a technical difficulty. Oh, no, we're not anymore. So Workplace Safety North, for those of you who may not be aware, is a partner in the health and safety system of Ontario. In our very beginning, 90 years ago, we were primarily mining, pulp and paper, and forestry. In the last 5 years, our mission and our vision has become Northern Ontario. And you see from the video, the picture that we're showing you is every worker home safe and healthy. When we say safe and healthy, we're going beyond just the physical safety of people now, and we're talking about the mind, body, and soul. So as a community engagement specialist for Workplace Safety North, I'm also a CMHA approved psychological health and safety advisor. And Workplace Safety North has asked me to take this messaging out to organizations such as CDDA, and other businesses across Ontario. So just keep in mind that when we talk about safety, we're talking about mind, body, and soul. So one of the things that I've learned in the last few years, if you're going to be going into your place of business and having a conversation around mental health or mental illness, I would strongly suggest that you set some ground rules. You will find that some people are uncomfortable having a conversation around mental health or mental wellness, and that's the stigma that's attached to it. So if you ensure that the conversation is safe and it's confidential, that no judgments will be made, and everyone has something to contribute, it takes the anxiety for some of the people down a few levels so that they can feel that they can be participatory in the conversation. So those are some of the few that have been given to me by other organizations. But once you have the conversation in your own place, you'll probably come up with some more. So if you do have a pencil or a pen and a piece of paper, what I'd like you to do, I'm going to say mental health, and I want you to write down the first word, the first thought, sentence that comes to mind. Don't think about it. So here we go. Mental health. I think I've given you a little bit of time to write it down, so just slide that to the side, and at the end of our session, we're going to come back to it. So often when I'm presenting, I'm asked, mental illness, mental wellness, are they two separate issues? And actually they are. As the slide talks to here, mental illness is a brain disorder. So within that, we have schizophrenia, OCD, substance abuse, anorexia. We don't expect our workplaces and those who work in them, our supervisors, our senior leadership, to become psychologists. That's not what this conversation is about. Much like when you take regular first aid, you are not a brain surgeon. If you are practicing brain surgery after your first aid, please stop, because that wasn't the intent. Just like there's a program called Mental Health First Aid. Once you take that, you're not a psychologist. It just allows you to have easier conversations. So then we talk about mental wellness, and you might have heard the phrase psychological safety. That's typically what we talk about in most workplaces. This is, talks to our mental well-being, our emotions, our thoughts and feelings. And it talks to our levels of happiness and how we actually manage our problems. So this is where you see a lot of conversation in workplaces. And we're going to talk later about how employers do have a legal responsibility to make sure that the workplaces that our teams are in are psychologically safe. So what you see here is a sweetgrass braid, and then you see some coins in the center. A few years ago, I was very fortunate. I attended some teachings with an Indigenous trainer, and one of the things that they taught us was about the sweetgrass braid. If you do have access to a First Nation in your community, I strongly suggest that you purchase a sweetgrass braid. When you rub your fingers on this sweetgrass in a downward motion, it's very soft, it's very soothing, it's very smooth. But if you get to the bottom of the braid and take your fingers and pull them upwards towards you, it's very rough. It doesn't feel as good. And our Indigenous trainer was teaching us that people are very much like the sweetgrass braid. We have two sides to ourselves. We have the soft, shiny side, and then we have the side that's perhaps a little bit rougher. So if you look at those coins inside of the braid, those are actually talking to the two sides of people. So let's look at the very bottom one. It says a sense of humor. When you flip that coin over, it can actually say rude. So I'm going to give you a moment to think about how your sense of humor may be viewed as rude by other people. Think about somebody, we're going to go to the second coin from the top, that you see as a leader. Would it be fair to say that sometimes that person might appear bossy? So those are the two sides to people. So I'm often asked, in person, you can do an exercise with these coins, and it's a wonderful way to have a conversation. It lightens the mood, and people get to learn about the two sides of each person. So you might be wondering, what is the tie-in with mental health in the workplace? Well, just like the Indigenous teachers teach us about, looking at the soft side as well as the rough side of people, when you flip the coin in mental health, that means when I get hired at your work site, and I've shared with your HR group and I've shared with my team that I suffer from severe anxiety, you don't forget to flip the coin and think about Angel, the driller, and just only see Angel, the one who suffers from anxiety. So it's a visual. If you actually have a coin in your hand and actually flip it, this is how we are going to start reducing stigma. We're going to flip the coin and we're going to look at two sides to the person. So what did we learn? We've learned that people are complicated. And in our workplaces, we have to be ready, willing, and able to look at both sides of a person. And sometimes it's going to be difficult. But if we're going to look at eliminating stigma and starting to have these conversations around mental health and taking a journey, we have to. So if you have somebody in your workplace that has two sides to them and may have already shared with you that they have a mental health challenge or they have a mental illness, if we actually started flipping the coins, how would that affect you, your workplace, and that person? Because sometimes all it takes is that first flip of the coin to make some change. So this is a great poster to put in your workplace. And it just reminds people we have two sides, and I'm a person, and I'm Angel the driller too. So why does mental health in our workplace matter? Specifically to CDDA members, for those of you who travel substantially, think about how much time you spend with your colleagues and not your family. When we talk about mental health and why it matters, every week in Canada, 500,000 of us miss work, either because of mental health issues or psychological safety issues. 500,000. That doesn't even include the ones that haven't put their name on a list or called into sick to work. They anticipate that any numbers that I'm going to talk to you about are extremely low because these are only reportables, right? It's not the people that haven't reported anything. So when you talk about 500,000 people missing work a week, the number's much higher. And people always say, yeah, and what about the people that go to work and talk about presenteeism? They're at work, but they're really not doing the job that they're supposed to be doing. So in effect, they're letting down their team. One of the things that I've learned from researching mental health in the workplace, and probably one of the most sobering statistics I've ever heard, is 49% of us who suffer from anxiety have never been diagnosed. We've never even been to a doctor. 49%. I find that very sad because if this 49% could go and access help, the world would be a brighter place. So those are the conversations that we need to be having in our workplace, that it's okay to go out and seek help. So we're going to do a little bit of a challenge, and this is something you can do internally in your workplaces. You can have a mental health challenge and ask people how much they know. And when you identify areas where perhaps you would like more information, then you delve into that. You can have a wellness committee, your joint health and safety committee can take a look at it. So the cost to the system is $10 billion, true or false? Well, that's actually false. The cost is $7.9 billion. Now, keep in mind, again, this is only the reportable stuff that we're talking about. So of that $7.9 billion, $4.7 billion is actually direct care. The 3.2 is in disability claims. But the interesting thing, there's an additional $6.3 billion that takes into account time off from work and uninsured mental health services. So an additional $6.3 billion. When you talk to the experts around mental health, they caution you. These are only reportable. We anticipate that the cost is much higher. Do you know what the cost is for your organization? Should you know? And do you want to know? So how many Canadians are suffering? I'm sure you've heard the 1 in 5. Well, the 1 in 5 has now become 1 in 3. And some people even suggest it's 1 in 2. We're looking at over 2.8 million Canadians. 10 Canadians die every single day from suicide. A quarter of people who have mental health or mental illness have never even discussed it with their doctor. The experts who study mental health are suggesting to us that anxiety and depression are nearing epidemic numbers. And just like we say in physical safety, one is too many. Just like in mental health, one suffering is too many. Employers, do you have to provide a psychologically safe workplace? I'm sure you know what the answer is. In Canada, there is a legal duty to provide and maintain a psychologically safe workplace. We know that there's been some changes in Ontario with WSIB. In our Occupational Health and Safety Act, we now must address workplace violence and harassment. You know, we're often asked, what does a psychologically safe workplace look like? Perhaps the easier question is, what does it not look like? And I think if you can be honest for a moment, you know what a poor psychologically safe workplace looks like. It's the eye rolling, it's the gossip, it's the inclusion of some people, there's no fairness, there's no camaraderie, there's no engagement. Those are all the things that contribute to a poor environment. I mean, one of the words that we often use around psychologically safe workplaces is the word culture. What does your culture look like? What does it support? Does it support a safe environment, or does it support an environment where people feel uncomfortable and unsafe? So you do, by law, have to provide a psychologically safe workplace. But if we take it to the step that, to me, all that really matters, it's about people. Everybody we work with belongs to a family. There's a family that's waiting for that person to come home, and they'd like them to come home safe and healthy, body, mind, and soul. So 2020, which isn't that far away, the World Health Organization estimates by 2020, depression is going to be the second leading cause of disability. The only one that will be higher is heart disease. Just think about that for a moment. By 2020, depression is going to be the world's second leading cause of disability. It's staggering. And when we talk worldwide, that means worldwide means our company, our people. This one I love is this mental health stuff is a fad, and this doesn't belong in the workplace. I've had this question asked to me probably at least 25 times in the last year. And when I'm asked the question, I ask them to think back maybe 25 years ago, 30 years ago, about what things looked like back then. Because I had a gentleman tell me, well, you know, back then in the day, we just pulled on our big boy pants and we went to work. And that psychology stuff, that belongs at home, it doesn't belong in the workplace. And he said, really, it's just a fad. And I said, well, let me share with you a story about going back 50 years ago, when in my neighborhood, there was 3 mothers who we were told that they were gone for medical surgeries, where in actuality, they were in hospitals because they had nervous breakdowns. Nobody talked about it. So there was a certain stigma attached. My mother was one of those women. We never knew as children that she'd had a complete mental breakdown, right? So now you fast forward 50 years, is it a little easier to talk about? We're trying. Think about, you know, Bell Canada, and they have, you know, let's have the talk. Well, we have to start by having a talk, but we also have to have a commitment to each other that we're going to move beyond talking and we're going to actually take some action, because it's definitely not a fad. It's here to stay. So maybe we have taken some steps to erode some of the stigma that's attached to mental health, and for that I applaud you. And if you're listening to this today and you've made a step in eradicating stigma, congratulations to you. So the responsibility for mental health rests solely with supervisors. If we have some supervisors listening today, I'm sure that's not what you want to hear. I will share this with you. It doesn't rest solely with you as a supervisor, but you do have more care than others. If you're supervising a team, you know your team. You know when they're off. And I'm not asking you to be a psychologist. I'm asking you to have the proper skills to be able to have a conversation and say, hey, Bob, noticing you're a little off today. Is there something going on? Is there something I can help you with? If you have an EAP program, I suggest that you call it yourself first, see what the conversation will be like, because you don't want to be suggesting somebody call EAP and you yourself have never called it. Research shows that sometimes if it isn't a good conversation, the person won't call back. And that's not what we want. We want our supervisors to have information at their fingertips that is going to help their teams. So the business side, well, we talked about it. And for organizations that have looked at the business side of ignoring mental health, they know they can't any longer. The numbers are staggering for companies, and sometimes that's what makes us stand up and take a look. It's the numbers that are coming in from our accounting departments when we see what we're paying for our EAP programs, our drug benefit programs. So the business side is there. And if we look to it, if we can make our workplaces safer, and when I say safer, I'm also talking psychologically, we can reduce the cost that is on the business side. Legal, we've already talked about it. When we talk about bullying, harassment, especially in Ontario, it also includes domestic violence. Most of those situations have a mental health component to it. If you're chronically bullied at work, it's going to affect your mental health. When I was raising my 5 children and explaining to them about bullying in school, I also had to give them the bad news that it wasn't going to end once they left school. It could still continue in their workplaces. And legally, we have an obligation to make sure that our workplaces are psychologically safe and physically safe. What we talked about earlier, really, does it come down to the people? I mean, everyone I work with is a mother, a father, a daughter, a sister, a brother, a neighbor. They have somebody who cares for them and loves them and wants them to go home mentally and physically safe. We know that if we protect the people that we work with, it pays itself in spades. Remember we talked about earlier about how much time you spend at work? These people, just by default, become members of our family. And typically, what do we do with family members? We protect them. We keep them safe. So the 1 in 5 has become the 1 in 3. So I ask you this, when you're in your workplace and you look at the numbers in your room, you could be with other colleagues right now, or you're in a team meeting, you're in a safety talk, look around. 1 in 3 is you and me now. It's not something that's so foreign that we can say that it doesn't impact our workplace. It's the people down the street who need to be concerned. It's each and every one of us, and it's not going away. So what does your workplace do to contribute to poor psychological safety? One of the most apt descriptions I've had of this is a woman who shared with me that she worked at a workplace, and every time that she would walk into the staff room, the minute she stepped the foot over this certain line, they would start. The first person would turn away from her as to not make eye contact. The second person would make eye contact but pick up their phone so they didn't have to talk to her. The next 2 people would put their chairs very close together and have a conversation with their heads bowed. She said everybody in the room would do that to her. She said the days turned into weeks and the weeks turned into months. And then at that point, she just couldn't cope any longer and she left. She actually left the employment of the organization. And when HR did their final discussion, they said, why are you leaving? She said, because my psychological safety was at risk here and nobody did anything about it. So think about your workplaces. It can be in the office. It can be out in the field. What have you seen that's contributing to poor psychological safety in your workplace? Tomorrow or this afternoon when you see it, will you say something? You know, I was having a conversation with high school students last week around psychological safety and health and safety, and we talked about drinking and driving and texting and driving, and I asked them, if somebody in your group was going to drive drunk or was going to text while you were in the car, would you stop them? This small group of students, there was 21 of them, they all unanimously said, oh yes, I wouldn't let them drink and drive, and I would not stay in a car with somebody who was texting. And then I said to them, what if you saw somebody bullying somebody else? And then they get very quiet and they said, well, that's harder to do. And just like in our workplace, it is hard to do because it's a difficult conversation. You have to say to one person, you know what? I will not allow you to call Angel crazy anymore. It's just not acceptable here. I won't allow you to totally ignore Ian every time he comes to drill for us. I won't allow you to do it anymore. Those are difficult conversations. I want to share with you, there's a ton of resources though, and at the end of the webinar there will be resources available, and actually my name and address will be there, and if you'd like more information, feel free to reach out, because we don't have to reinvent the wheel. There is so much information out there, a lot of it is free, and a lot of it is very, very accessible. So I'm going to show you this little video.
Listen, I know you're sick and all, but are you even trying to get better?
Hey, look at it this way. There's plenty of people out there that had it worse off than you do.
You need to stop focusing on the bad things in life and just try to enjoy it. It's all in your head.
I don't think you need to be taking medication every day just to feel normal. Don't you think it's changing you? Listen, you really just need to suck it up. Like, everybody goes through this, and you're just feeling sorry for yourself. Why don't you just go to the doctor?
Thank you. My insurance doesn't cover this one.
David. Man, that's broken. You need to see a doctor.
Seriously, I'm fine. I get better on my own.
So did that resonate with anyone? I mean, it's easier to see the physical rather than the emotional. Would you agree? And until we get to a point where we are actually, walking into a workplace and saying to them, this is what's going on, we have to recognize the fact that it's not visible to the eye. These three people here represent depression, bipolar, and anxiety. You tell me which person has which challenge. It's not visible to us. Unlike this, which is very visible. Somebody walks in with a cast into your workplace, what do? You help them. With their carrying lots of items, you help them carry it. You just don't leave them on their own. But when they walk in looking like this, you're not sure how to help, right? So somebody has once said, well, wouldn't it be a lot easier if we just walked around with Post-it notes attached to our jackets and our shirts? Now, this is an exercise you can actually do in your workplace, and you can have a conversation about the Post-it notes. It's much easier if I walk in and I have a Post-it note attached to me and it says, I suffer from SADS, which actually I do today because I drove through a snowstorm, the first one of the year, to come in and do this webinar. My kid is in trouble. I'm having a bad day. Can you just help me out? I have OCD. Very few people are willing to wear a Post-it note that talks to this. Once you have an organization that starts having the mental health conversations, this becomes a little easier. You'll find if you're starting the conversations in your organization, one of the most wonderful things you can do is take those ambassadors, those who speak freely, either they've had a challenge with mental health or they have family members that do, and they're willing to be the ambassador in your organization. Work with them. They can be your greatest friends through this journey about having the conversations. And most workplaces that I've been to, including my own, we have those ambassadors, we have those heroes that are willing to help us start to have the conversation, but then move us into that continuum of the journey, much like we've done with the physical safety. So this goes back to me, you, and us. Remember the flip the coin? Know me as a person, not my mental illness. Right? Remember, I'm Angel, the amazing driller. I'm the best one in Canada. That's why you hired me. But, I may also have the depression or I have anxiety. So this, again, is another way to have a great conversation with people about the two sides when you do the coin exercise. So here are 4 B's from a doctor who talks about mental health. Be aware. Is it happening in your workplace? Is your workplace psychologically safe? If it isn't, then we should be doing something to fix it, right? Be just. Treat everyone the same. We don't allow the bully to keep bullying because he's always or she has always done it. Be vigilant. Stop it. Stop it dead in its tracks. Don't condone it. And be careful. Keep an eye out. Don't get complacent. When the physical safety, we talk about it, and when we saw numbers start to jump up again is when people became complacent, right? So just like physical safety, along with the psychological safety, we always have to be vigilant. And we never have to forget that it's rearing its ugly head at any moment. So this was given to me by a young lady who said, you know what? It's not contagious. And you're not going to catch it by being kind to me. I thought, wow, you know what? Sometimes we think about that. I remember 25 years ago when I had to work with somebody who had AIDS. they said the same thing. You're not going to catch AIDS by being kind to me. I thought, wow, you're right. And now here's 25 years fast forward, and we're talking about in the whole realm of mental illness. So this is a question that many of us will struggle with. I'm not a psychologist. Are you a psychologist who's watching this video? Probably not. And we're not asking you to become psychologists, and we're not asking you to get into people's brains. One of the best lessons we can learn is from when we were little children, 4 or 5 years old. We were getting ready either to go off to kindergarten or to the playground. And that person in our life who was teaching us our morals and our values gave us probably some of the best advice that we can reach into our minds and take now. So think about being 4 or 5 years old and you're going off to school or you're going off to the playground. What did that important person in your life, your mom, your dad, your grandmother, the neighbor, teach you? They taught you to be kind. They taught you don't bully others, stop others from bullying others. And if you get into trouble, go find somebody who can help you. Same thing about mental health, right? We want to be a non-judgmental listener. We want to show empathy. We want to show our teams and the people that work with us and for us that there's help and we have resources available to them, right? We want to watch our body language. We don't want to have a conversation with closed arms and really far back from them. We want to lean into them so that they understand that we are being empathetic and we really do care, and we want to have the conversation. As difficult as it can be, that journey starts with one conversation. And it doesn't have to be scary. It can be a conversation that both of you walk away from and you both breathe a sigh of relief and you say, well, I'm really glad I did that. So just remember, you don't have to be a psychologist. Remember back to some of the lessons that you learned when you were smaller. So what are the next steps? Have one conversation perhaps, change one word, make a commitment to continue the journey. Somebody said to me, you know, Angel, we are tired of talking about it. We have to take action. What does action look like? Action for one of the clients I worked with was to eliminate the word crazy from their vocabulary. We were doing a mental health session and a woman stood up and said, I just cannot handle you using that word any longer because I think of myself. When I think of my own mental health challenges, I'm wondering if you think I'm crazy. And it makes me feel awful, and then I'm not contributing to my team or my organization. And right then and there, the senior leadership stood up and said, you know what? As of this day moving forward, we're eliminating that word from our vocabulary. That was their first step. What have they done to continue? Well, they've identified their ambassadors. This lady who asked for the word to be eliminated from their vocabulary has become an ambassador. They're training their staff in mental health first aid. They're looking at resources. They're looking at including mental health into their strategic plans for their business. They're talking about mental health and physical health the same. Each one of them has a place in a conversation. Each one of them has a place in budget. So you can think about what your next steps are. Your first step is that you watch this webinar. What you do next depends on you. But these, have a conversation, change a word, or just even make a commitment to continue the journey. So the World Health Organization has a definition of what mental health of well-being looks like. I'm not going to read it to you, but this is something that you can use in your workplaces to have a conversation about, does our workplace support this? Do we support each other? How can we change some things? People have used the statement to develop respect policies. They've used them to develop mental health policies in the workplace. It's a really good way to have a conversation. I just keep it on my desk so that I'm reminded of what good, state of mental health looks like. Because we can honestly quite easily forget about what we are doing to make sure that we stay in this state of well-being. So I'd like you to go back to that piece of paper that you wrote one word, a sentence, a thought on. And I want you to write down a word now after we've spent, 35, 40 minutes together. And I want you to think about if there's any difference in the word that you're jotting down. If you want to do this exercise in your workplace, I can share with you, typically you will see a change in the words in as little as 30 minutes. Typically, the first words that are talked to have somewhat of a negative connotation to it. Once you spend some time having a dialogue about mental health, psychological safety, other words start to appear. Kindness, my friends, have to have it. Those are the subtle differences that you see. So when people say, really, can we make change? If you can see in 30 minutes to 60 minutes a change in words that are used around mental health, that suggests to me that we can make a change. We can change a culture to the better. So on the days where I feel like we haven't moved very far along the journey, I think about the one word exercise. And I'm engaged again, and I'm ready to go, and I'm ready to hit the floor running, because I do believe we can create change. We just have to make a commitment to do so. So Dr. Martin Shane, if you'd like to read some of his work, he is a pioneer in this, and he actually wrote the book Tracking the Legal Storm, talking about what was going to happen with mental health in the workplace. So he said, it's no longer nice to do, but it's a must do. And if we go back to some of the earlier conversations we had around people, that's actually the best reason to have a psychologically safe workplace, is for the people that we surround ourselves with each and every day. So the final word is yours. I want you to think in your mind, what word are you going to use to have a conversation this afternoon, tonight, tomorrow morning, maybe at your next safety talk? When you ask everybody to do a safety share, can you ask them to do psychological safety share too? Sometimes that's how it starts. So I'd like to thank you, because along with myself, you've been guinea pigs today for CDDA. I want to thank Louise once again. It was quite enjoyable on my end. I'm not sure how you found it, but there's my contact information at Workplace Safety North. And if you do have questions or you would like more resources, feel free to reach out and talk to me. I'd be more than happy to have a conversation with you. And when I was putting together this presentation, I found this, and I thought, this is really what it's all about. Remember we talked about kindness? We don't know what's going on in somebody's mind. So maybe this is a reminder for you just to be kind. Here are some resources. The actual presentation will be posted on the CDDA website. And now I'm going to ask Ashley, who works for CDDA, to take over the controls to see if there's any questions. So thank you very much.
And there, sorry about that. Unmute them all. Unmute. He's already not muted, so we'll do that while I am. But he makes me okay. Let's see if anybody has any questions. I'll put you over here.
Hello.
Hello.
How are you?
Well, we are two guys from Greenland School of Minerals and Petroleum.
Greenland.
Greenland, yeah.
Welcome to Canada.
Thank you. Well, my colleague here, Curtis Chapman, is actually Canadian. In Greenland, we are a mixed staff here. So we are Danish, Greenlandic, Canadian, Norwegian. So it's a mixed culture. And well, we do recognize some of the problems that you are bringing to our attention, that among our staff, we have a lot of challenges. We know, or we suspect, some of our staff do have, mental challenges. Some of it is maybe, everybody coming with a different culture, and we have to be professional with everybody. And well, as management here at the school, we need some tools, trying to, find a solution for what can we do to improve the mental aid we could give to some of our staff. So we think, well, it was a bring up some new thoughts from us, and we will investigate, all the websites that you are showing here, and we might be able to make a what you call a handling plan.
I don't know the English word. A plan.
Yeah.
Plan.
Yeah. Plan.
Well, congratulations to you for saying that you're going to make a plan. I applaud that. And the resources that are there, I'll actually provide additional resources to CDDA, and I'll have them post them on the website. There's some really incredible information that's been coming out of the UK right now, and I've been accessing that quite a bit because it's brand new, and the information is fabulous, and it's very helpful, and it's free of charge.
Okay.
So it's a good way to get your feet wet, so to speak, to help you in your planning process.
Yeah.
And like we talked about earlier, if you can find, other than yourselves, some ambassadors to really lead the project, if you can have senior leadership. I know in our organization, we have a senior leader who comes out and speaks publicly about mental health and some of their own challenges. That really makes a huge difference in the workplace. It talks to the culture and being safe, right? And those are some of the, at the very beginning, we talked about ground rules. So that can be quite helpful. And my address is there, so feel free. If you just want to fire me off an email, I'll help you as much as I can.
Okay.
Thank you.
Sounds great.
Thank you. Good luck with your journey, gentlemen.
Okay, thank you very much.
Does anybody else have anything they'd like to share? Any questions?
It's Mike Sweeney here. I'm with Glencore in Sudbury.
Hi, Mike.
Hi, Angele. I had a little trouble hearing the video that you were showing.
Okay. Would you like me, what I'll do, Mike, is I will provide the web link to CDDA and they can attach that to the resources. How would that be, Mike?
That'd be great. I think we're going to download that.
Okay, great. There's also, I'll find you a couple of others. There's a couple of different videos, all in the same theme, that may be helpful. So you can show a couple of different ones depending on your audience. So I'll also include those in the resources.
Okay, that's great. We've got a pretty good program here for health and wellness at Glencore in Sudbury. So
you do. Congratulations, and thank you for joining the webinar. That just shows a level of commitment, right? And we can all continue to learn.
Definitely. It'll be interesting to see what the legalization of marijuana has and how much of an effect that's going to have on mental health in the next year.
It's interesting you say that, Mike, because yesterday morning I was having a conversation with an organization in Sudbury, Ontario, Canada, about mental illness and drug addiction. And this is the industry she works in. She's an expert. And her suggestion to myself was they go hand in hand. So certainly we anticipate you're going to see more conversations around it. But it goes back to, like, some people are saying to me this morning, well, because it's legal, it's going to eliminate the stigma. And maybe people will talk more about addiction problems. I don't know. All I know is that in Sudbury, Ontario, Canada today, you cannot walk around with a marijuana cigarette downtown. That was the big tweet that was going out this morning by the police, because I guess there's one law that hasn't been passed yet. So you can only enjoy cannabis in the comfort of your own home as of today. So workplaces, Mike, have a one-day reprieve. Is marijuana legal in Greenland?
No, it's not.
No?
No.
Would you like us to keep you updated on how it's working out for us here in Ontario?
I follow the old Canadian news. I can see
There we go.
Stoned from now on. Canada's going to fall.
Is there any other questions? Any other comments?
No, that was great. Thank you.
Well, gentlemen, I believe it was all gentlemen on the call. Thank you for contributing to the conversation. Thank you for having the conversation. And I do hope that it was a wise 45-minute investment of your time, because I hate to be the bearer of bad news. You're never getting that 45 minutes back, gentlemen. So I hope it was a good return on investment.
No, thank you.
Thank you very much.
Safe and healthy day.
Yeah, you too.
Thank you.
Take care.
Bye-bye. That was valuable.
Yeah.
Yeah.
Absolutely.
Stop the recording.